One of the questions that was asked of me a while ago in the last course, and I really want to emphasize this because I think it's really important, is about pre-frame. So therapists from their traditional modality or what they've learnt before is let's pre-frame your client. You're going to set them up and you're going to give them instructions of what's going to happen throughout the session, how it's going to look like. You really don't have to do any of that when you do advanced conversational therapy because you're setting them up. When you do your old pre-frames, you're setting them up for expectations. You're going to give them an assumption of what the session's going to look like. When you don't know what the issue is when you start delving into it, your client doesn't know what the issue is, where it actually all started from, the root cause. How can you pre-frame what the session will look like? Don't think that you need to pre-frame or prepare your client for what the session will look like because you're really just setting yourself up for an expectation of your client to you and to how the session will be. The session is going to vary all the time. Your clients, even though your client has the same symptoms as everyone else, depending on your niche, it doesn't necessarily mean that your client is going to have the same experience, is going to react the same. Every session will be different. Every session will not be what you expect, what your client expects. And also you can't really determine whether it's going to be a 20-minute session or a 2-hour session. So pre-framing and giving your best assumption of how it's going to turn out and how it's going to look, you're really going to set your client up to a high expectation. And really all you want to let your client know is that you are there. It's going to be a very natural progression, a very safe environment. You're going to be there every step of the way. So don't feel like you need to pre-frame your client or yourself because who are you doing that for? Is it for you to validate what you're going to give to your client? A lot of the time, therapists think that I have to justify the session. I have to justify how many sessions. I have to justify that the outcome's going to look like this. Don't feel like you need to do anything. A lot of the time, it really is about the therapist and what they are concerned about. Feel like you are just going to be there for the client. You don't need to pre-frame. You don't need to give a whole rendition of what the session will be.